2022 is a new year, so let's make a new plan for a new you, especially where your health is concerned. Here to help her make this plan is Dr. Janet Martin, chronic disease and behavior therapist with the Doctors Hospital Health System. Good morning and welcome to Bahamas at Sunrise.
Good morning, Mark. Welcome back.
Yes, thank you. You know, I'm here officially now. They can't get rid of me, so we try to behave.
New year, new rules.
Exactly. So glad to have you on the show. So we're talking about, like you said, new year, new plan, new you. So how can the acronym PIP or PIPP help us focus on health? Hopefully.
Well, when we look at PIP, we're looking at the first P is planning. If we want to make any kind of change in life, we need to set out a plan, whether that's a plan to change our eating habits, unhealthy eating habits, whether it's a plan to start walking or doing some form of exercise, or it may be to change an attitude or a behavior that is not, is counterproductive to your health and total wellness or the relationships around you. So we always have to start out with a plan. We plan our work and we plan our lifestyles. And so the next letter in the acronym is I, and that's how important is that plan to you? What are the ingredients are you going to draw from to implement this plan? And you know, when you set out a plan, it empowers you. And so in empowering yourself, you need to draw either if it's food you're going to change, the way you're eating, what kind of ingredients are you going to put into your meals? If it is relationships, are you going to draw closer to persons who are life-giving or draw away from those who suck your life? So, yes. And so the next letter P is preparation. Mm-hmm. What is the purpose of making that plan? What is the purpose of setting new goals? And how realistic are those? And how are you going to prepare to implement your plan, your strategy for 2022? And of course, the last P is portions. And I like to start with portions of love you give to yourself first. God calls us to love our neighbors as ourselves. That means we have to give portions of love to ourselves first. And in so doing, when we portion out our food, are we going to make changes in the area of, implementing some changes with our food plan, or the portions of food we're going to dish out to ourselves? The portions of love and patience we're going to dish out to others, because people are different. And so our plan for 2022 should incorporate, it should be purposeful, it should be joyful, it should be life-giving to us and to others.
Wow, that was very comprehensive. I feel like we could cut the interview now and just go, because I can take that tip and run with that. But yes, very important points that you mentioned. You got to plan, you got to, look at the ingredients, prepare, and your portion. So, people may set these plans, they might set these goals, but how do we address barriers to accomplishing our goals?
And that is very important because, life happens. I say to persons, life happens while you're living. And we have plenty environmental triggers that come up, and they come up as obstacles in our lives or barriers. And we have to learn how to navigate the environmental forces that come out. Sometimes it's work. If it is work and work is pressuring you, you need to find a work-life balance. Mm-hmm. How do I implement my plan and get 15 minutes of exercise in the morning rather than pushing for 60 minutes because I have to get to work on time? How can I implement my changes in the way I eat with all the cost of living going up so high? And the grocery stores are already warning us that come 2022 that the prices are going to go up. How can I implement that plan? That's a big barrier for some persons, especially those who are living, and barely making it. So How do we strategize around that? Do we go and look for specials? Do we stock up on certain canned foods, especially the different fish and vegetables that we can't afford if we can't afford the fresh ones? And so we need to strategize, create strategies. And sometimes we have to move people out of our lives who present themselves as a negative barrier. And so through prayer, through practicing mindfulness and awareness, that is how we strategize around those barriers. We look for triggers, and when the triggers come, then we need to step back and see how we're going to move forward.
So you've mentioned triggers, and that's where I was going to go to next. So we have this plan, we see the barriers, but we don't always follow through, and sometimes we may fall short. So what are some of the common triggers, and how do we make a plan to avoid them?
Okay, some of the common triggers, if you want to, say for 2022, I am going to start an exercise program, and for the first 3 months, I'm going to be vigilant. Well, then the first thing you need to do is to ensure that you have the right shoes. So that's a trigger could be work. It could be at home. It could be someone that you expected to partner with you and they let you down. It could be just, I'm feeling tired today, or I had a long day. Another trigger could be if you want to change some eating habits. You go into a home and they offer you something that you just love to eat. Or you're stressful, and when you're stressful, you seek the comfort of food. You seek the comfort of chocolate or something sweet. And so those are some of the environmental triggers. It could be, another trigger could be, you go to the doctor and you're diagnosed with something that you feel is out of your control. Now that is a health trigger. Your blood pressure is high and you need to make some changes. Right. How do we strategize? We look for someone like myself to help you formulate some plans around those behavioral changes. And what is important with those triggers is to self-monitor, to talk to yourself, to encourage yourself, to be mindful of those triggers, and then how to avoid falling into those holes that the triggers create.
Yes, I love that. My trigger is my driving route, because, these fast food places, they project the smell into the air, right? So I can't drive that way. I need to stick to the coastline where there's no fast food, right? That's my strategy.
Well, you stick to the coastline and you get all of those restaurants.
So before we go, I wanted to just focus on this last question, and it's, in the midst of all this planning for new health, new you in 2022, is how do we focus on why we need to change, or on why to change, the why behind it?
The why is so important because, with the new year, all of us want to make some changes. January 31st came in and we all, might have gone to church and we said we're going to make these changes. But the why is so important because we need to answer that question so that we build on our motivation. The answer to the why increases our motivation to change. And some of those whys can be, like I said earlier, your illness. You're diagnosed with prediabetes. Well, then I don't want to become a type 2 diabetic. And I know that that's lifestyle. So I need to find someone like Jan and go to Jan so Jan can help work with my prediabetes so I don't move into type 2 diabetes. Yes, and communication, So the why is always something to do with you personally. That's why the changes have to be purposeful.
Yes. And I agree 1,000%. The why is most important. For me, my why is I want to be here as long as I could for my children and to see them flourish in the future. So we're so happy to have you on this morning. Probably again, Dr. Janet Martin, chronic disease and behavior therapist with Doctors Hospital Health System, talking with us about 2022, new year, new plan for a new you. Thank you again for joining us on Bahamas at Sunrise.
You're quite welcome. I'm always here for you.
Thank you for joining us. We'll be right back.